Multi-unit abutments, if you guys aren't doing a lot of full arch, this is just kind of a new concept. It's kind of this is a new part that you probably haven't handled yet. But here's the why behind these, because I did some fixed implant cases early on without multi-unit abutments, because early on you think, why do I really need these things? Like, they seem like kind of a pain. Like, why can't I just do a bridge on implants, direct to fixture, direct to implant? It's just not a good idea. And I saw that firsthand in the complications that can come from that. So why do we use multi-unit implants? First off, it's to bring the restorative platform to tissue level. So, back in the day when people used to place, tissue level implants that were all in one, it's kind of going back to that. You're bringing the restorative platform to the tissue level because it's convenient. You're taking these restorations on and off for impressions and try-ins and whatever, and you don't want to be going down, shoving down below the tissue to your implant level. So you're bringing it to tissue level for convenience. And it says at or slightly below. In an ideal world, you're just sub G with that margin, just barely sub G, because it's hidden. Everything is just kind of hidden, but it's convenience. What else does it do? It removes the engaging aspects of the connection to allow for splinting multiple implants. If you guys have done implant bridges and you're trying to go direct to fixture and you got 1 hex and 2 hex, and you're trying to restore to that, and you're trying to screw down and have 2 hexes go down into the implants, potential for issues, right? Now try to do 6 of them, not going to happen. So you can, you could have a non-engaging component, right, with an implant bridge where you're hacking off the hex and just having.
Well, we've all been there.
We've all been there.
Drilling down your hex.
Yes. We've done that. So, multi-units, you have no engaging components. You're not worried about engaging rotations of a restoration. And then the last thing is highly tapered external connection. So, this looks like an external connection of the old Brandemark implants that they used to use. It's the same kind of idea, which normally we don't like that, but in full arch world, we do like that. So it's an external connection that's highly tapered. This is a big cone here because, with the more things are connected, the more taper you want. Just like if you're doing a big bridge, a roundhouse bridge, right? You just TP all your preps so that you have draw and everything. It's the same thing with this, is you have to have draw across 14 teeth, or 6 implants across the whole arch. So you want a lot of draw, and that's why these things are highly tapered. So that's why multi-unit implants. And then they come in, for most companies, they come in straight, 17 degree and 30 degree. Neodent has got a 45 degree for those extreme cases. But this is the most common 3 that you see. They allow us to avoid sinuses, nerves, and then lingually inclined anterior teeth. Straights are usually a little bit cheaper, $50, 84. This is DES. These are the DES parts that are the most common. Straights a little bit cheaper. Straights, you don't have to worry about timing in a guided case, right? So if you want to make your life simple, start with trying to just do straights if the case supports straights. On the maxilla, usually you want to angle because you want to get as far distal for AP spread as you possibly can to avoid the sinus. But straights are nice when you can do it. They come in different collar heights. So 2.5 millimeter collar, you can get 3.5, 4.5, 1.5. Same with the angles, you can get various collar heights, regular platform and wide platform, which is like what a lot of our implants have, 3.5, 4.5, 5 kind of stuff. In the multi-unit world though, so our implants that we use is a lot of times this NP connection, this narrow platform, Nobel active connection. But in the multi-unit world, don't get confused if you see it's an RP, because it's a separate platform that you're talking about. So this implant that we're using right here, the connection from the multi-unit to the implant, we use the NP because that's what the implant we're using. And you got to use the one that's specific for your implants. But up in here, it's going to say RP for regular platform. Because in the multi-unit world, in the Nobel world, there's just regular platform and wide platform, and nobody uses the wide platform. So if you see, I got confused on that early on. I said, wait, is it regular platform on the website? I thought I was using narrow platform. And it's talking about two different things. It's talking about the multi-unit pump. So don't get confused on that. Restorative parts. So temporary cylinders, this is going to actually screw onto the multi-unit abutment. And this is just a cylinder that's sticking up that you're going to use for pickups of temporary prosthetics if you're doing a pickup conversion. This is an analog. So here you go, multi-unit RP. And this is where, I remember early on getting confused. I go, I thought I was using NP. Well, it's talking about the connection up here, not the connection of the implant. So for analogs, it actually has the head of a multi-unit on there. And that's the analogs that you're going to use to pour up, stone models when we're doing the PMR. And then they've got various scan bodies. I like this lab scan body to put onto the master cast. So just some different parts there. We talked about immediate loading, teeth in the day. It's the kind of the hot, sexy topic.